They offer a natural alternative to breast reconstruction. And here to tell us about the procedure and who is a good candidate are Doctors Matatov and Rozbeh Torabi with Aesthetic and Restorative Breast Center. Good morning, gentlemen. Good to see you.
Good morning. Good to see you.
Dr. Matatov, let me start with you. What is the difference between autologous and implant breast reconstruction?
Sure. Well, implant breast reconstruction offers two different pathways. One would be that you would get a permanent prosthesis reconstruction immediately after the mastectomy, meaning the breast removal, or a two-stage reconstruction where you would undergo a tissue expander to recruit some more more skin, and then have an implant reconstruction. The good thing about implant reconstruction is a fairly quick recovery. The surgeries don't last as long, and it's an off-shelf product. So you can get sizes of, depending on what you feel like you want your breast to look like. But the downside to implant reconstruction is that over time patients develop capsular contraction, meaning the implant gets displaced. The implant can also migrate. There's always a risk of infection since it's a foreign body. And there's never that natural feel of the breast with implant reconstruction that you would get with your own tissue. And compared to an autologous reconstruction where we use your patient's own tissue from undesired areas like the stomach, which is also called a DIEP or a tummy tuck flap, you know, inner or outer thighs, and we reconstruct and restore the breast with that tissue. So in certain situations where patients do not have enough abdominal skin or anywhere else, we sometimes do resort to implant reconstruction. But majority of patients do have excess tissue that can be used. And the way we do the surgery in our technique, we do not use the muscle, which is very crucial for function. Like the abdominal muscle, that's your core strength muscle. If you remove that, people do get weakness in their core strength. And there's very minimal risk of infection. It's a long-lasting result. You usually do not have to have multiple procedures after you're done. There's a natural feel to the breast.
And as you were saying, you can make it how the patient wants their breast to look like. Dr. Torabi, let me ask you, who's a good candidate for this?
So a good candidate's anyone that's getting either most of their breast removed or their entire breast removed. It can be done at the time they're getting it removed or even after it. Some patients need to get radiation or something, so we put tissue expanders until they can get it. But our main thing has been, there's a lot of patients that have had implant reconstruction over implant reconstruction. They've had sometimes, like you're talking about, 10 to 12 surgeries, and they haven't gotten the results they want. And their breasts have all these defects, so we go in there with using their own tissue, we're able to give them a more natural result.
And you're able to correct that. So Dr. Matatov, what is a designer autologous breast reconstruction?
So one of the advancements of breast cancer treatment is individualized care per patient. So it all depends on tumor biology and also stages of cancer. So with designer flaps, it's kind of the same thing. We design your breast reconstruction based on where you have excess skin and tissue that can be removed, and it's different from patient to patient. And if you look at surveys from breast cancer patients, majority of patients that have undergone autologous reconstruction were much more satisfied over time than implant reconstruction. This has been proven over time.
So Dr. Torabi, when is a good timing for this procedure?
So it's up to the patient, and sort of like we see how their skin is as well as their treatments. Like as I said before, if they're getting radiation, we're going to hold off because that's sometimes can kill off the flap or even shrink down the flap. So we stay away from, you know, killing our flap with radiation or something like that. But if they're just getting prophylactic mastectomies or something like that, then we could do it at the same time as the general surgeon or the breast surgeon removes the breast.
And what about health insurance? Is this covered?
Absolutely, it is covered. All breast reconstruction is covered under the Federal Act, which is Women's Health and Cancer Right Act of 1998, where as long as you're associated with a breast cancer diagnosis, the breast that has cancer as well as the contralateral breast are covered by the insurance company. And then we have a a specialist.
So they can
insurance
come
specialist.
into you and you can kind of guide them through this process.
Correct.
All right,
Correct.
doctors, thank you so
No,
much.
thank
We
you.
appreciate it. And if you want to learn more, you can visit their website, breastreconstructionaz.com, or call the number you see right there on your screen.